Thank you, Samina, for asking me to be part of your IC, and thank you, friends, for staying back, overcoming the hunger pangs. And Samina gave me this topic probably because of my.
We will have some time for questions. So if you do have any questions, please keep them ready.
Okay. So we have so many challenges in healthcare, right from the regulations, accreditations, and now the insurance payment, all focusing on the medical community. And now this is our situation. We are mired between the so many stakeholders, the government, health insurance, patient, the information overload from various social media, and here we are mired in these situations. So what we practitioners lack is the time, desire, knowledge, and certain resources. So in my experience of assessing over 80 hospitals, so this were my general observation about the management of hospitals. Inconsistent and variable care, and this variation not only with care, between physicians, between staff, and also the shift variations. And a lot of wastage in terms of time, energy, resource, money, and clutter. So we have huge spaces, but most of them would be cluttered, over inventory or poor inventory, and no continuous quality system. Most of them wake up just before the assessment and do some superficial things. And most of these we have seen in practice run by doctors. Basically, they are clinicians now into a part of a management, but to stay in practice, to be on the upside of the practice, you need to handle practice like this. So if you are spending 5 to 6 hours on patient care, you have to spend at least 2 to 3 hours on your practice. And these are the books, apart from the Kansky and all sort of books you read for ophthalmology. These type of books will really give a insight into what how you can manage your practice. One of the best book I've read is the Toyota Way and Lean Thinking. And this lean thinking, so most of us are used to taking a resolution during the new year that I should become lean by 10% or 20%. I think you should also include this resolution next year. My practice should become lean. And you need to concentrate on cutting the costs. So what is this lean principle? It's basically a systematic approach where you are trying to eliminate wastage through continuous improvement. So I'll make it a bit simple. This principle is a way of thinking and organizing your practice, pioneered by Toyota 60 years back, and it's basically a quality method. And there are so many tools available to reduce waste and increase value. So lean is basically not a job reduction strategy, because the moment you start organizing these kind of things in your hospital, your staff will get worried that their jobs are not safe. And lean is not just about a manufacturing principle. It's basically a management thing. And a lot of tools are available. And some of them are Japanese names because it originated from Toyota. So basically, these 5 principles define value from customer perspective. We think value from our management perspective. What this principle says is, what does your customer want? What do they value? And identify the entire process and value stream and implement the flow principle. So let me just tell you how we can apply this to healthcare. So my talk is basically how it can happen, and give some examples of what we did in our hospital, basically opticals, lab, pharmacy, and a few random thoughts on how this can help. Healthcare, you know, is a diagnosis and treatment of illness, whereas lean is the diagnosis and treatment of your hospital process. It's a way of looking how you can improve your processes. So you have to understand this wastage. Anything that adds cost or time without adding value to your customer. In this, the customer is the patient and their attenders is wastage. So a patient would be willing to pay if there is value added, and he will resist paying if there is no value added to that. So what are the wastages? So basically about 7 or 8 wastages in hospitals. And so 90% of lead time is non-value added in many of our hospitals. I'll just simplify for it. One is the transportation wastage. So it's basically multiple rooms for each test. Patient has to walk, wait again in the reception, again walk. So there's a lot of time wastage. Inventory excess, not only in IOLs, even in pharmacy, even in our stationery, we have a lot of too much of products. And this again, if you see the expiry part, there's a lot of wastage. Movement wastage. Staff has to move to various places and facilities in different areas or different blocks. And waiting time. You all know this is a major concern in eye hospital with the dilatation or without dilatation. And it's not only for dilatation, for registering, imaging, treatment procedures, ward procedures. Everywhere there is a lot of waiting time. And this is a waste from the patient point of view. Over processing wait. So very often you see more staff, more doctors, more frames in the opticals, more drugs in the pharmacy, more IOLs in your operation theaters, and this leads to a lot of errors. So the moment you have over inventory, there will be a lot of wastage and errors, and defects and errors. So this is what we are trying to cut across through accreditation standards. So there is a lot of wastage with reference to reworks, whether it's optical or if you are surgical rework, and also compliance cost and legal issue with reference to the licensing. Unused creative. We are not using our staff for improving our structures. So that leads to staff attrition and wasted talent. And this is how it adds to the cost. If there is a waste, whether in process variation, it adds to the cost. And your investment increases, your inventory increases, and people are frustrated. So how we can, what are the tools to know what is exactly lean or waste in your practice? So these are common tools, and the oft-repeated word is the lean. There are various other principles like 5S, Six Sigma, and Kaizen, which are very common in Indian manufacturing sector. And this is an overview of this lean management principle. So basically, to achieve high quality, lowest cost with shortest lead time. And one of the major driver for this lean principle in hospital is the mediclaim or the insurance industry. They've been projecting 20 to 30% cost, and government has initiated steps to reduce this cost further. And so we have to really move towards value-based payment and adoption of digital health technology, increase transparency with reference to the costing, and future will be defined by quality and patient-centric care and not this kind of marketing or marketing. So how we can do this? You have to go to the field, not sitting in the room. So you have to go to the actual workplace, see what are all the waste processes involved, write down, discuss with your people, and plan how you can remove that process or work from the area. So our experiences, I hope this video runs. So redesigning patient journey, we started from the basic. Actually, patient flow in any system has to be like a river. So if the water is stagnant, it adds to the confusion as well as add stink. So basically, this is the process in many of our hospital: reception, optometry, consultation, and each process adds to the 20 to 30% wastage. The most common wastage happens in waiting, particularly registration and refraction. So we took a time analysis for each step. We divided this into 10 or into 8 process, and this is what happened. We saw that we are wasting a lot of time in the during the lunch time. People are very busy in, between 10 to 2, and so we wanted to reduce that. So transition time was more between each procedures. So this was our major principle to reduce the time taken for care delivery. So we decided to shift certain areas, bring the optometry areas and the consultation room closer to the waiting area. So the patient has to just walk 10 steps from each area, and there will be announcement and TV here for the next patient. So this reduced our transition time, and also we had added some cubicles so that one staff will need not wait for the patient. So 3 cubicles for one staff and 1 doctor. And we also reduced confusion with reference to access. We added access control doors, And this is how it looks like the ideal time came to, we are able to at least reduce the time for 70 to 80% of the patients. And crisis, this really happens in any hospital, and we are left to doing crisis management every day. So that is actually a lot of wastage, and we integrated our HMS and EMR, and so we followed all the quality principles within the EMR systems and used the data to reduce wastage. So this really helped us in reducing the paperwork, and also people are happy after some training. And reducing the errors, again, 5 years implementation, sorted all the pharmaceutical things and did this analysis and find out these are some of the common dispensing errors. So we made all prescription 100% electronic so that these errors can be reduced, and we made a lot of templates so that this error can be reduced. So inventory, again, we took average of our utility for 1 month and then 3 months, and some of the things which are rare we ordered for 3 months, something which is within our area we ordered for 1 month. So we changed our inventory policy, and also trained people to take care of certain things like licenses. That takes a lot of our management time, and this is CPR training, code blue training for our people, so they are very confident about handling emergency. Licenses were put in place. All this we integrated within the accreditation system. And power optimization, we installed about 10 kVA solar thing, plus backup for theater and essential equipments. And this is very important for accreditation as well as for wastage reduction, communication and documentation. All this have been integrated within the EMR system, and there is an alert system to reduce EMR. So the moment you chose another IOL, there will be a red alert in the theater. Similarly, any change in medication, there will be an alert. So basically we use the accreditation system to our advantage to reduce wastage and focus on this 5 S measures. So we are now into the 3rd S system. So hopefully by next AOS we'll be having the 5 S system in place. So basically quality and lean management system is a journey. So to enjoy the journey, quality would be the base of the top of the umbrella. We need to incorporate certain principles like patient satisfaction, employee morale, cost consideration has to be there, and safety aspect cannot be taken for granted. So lean management would be a ideal thing to reduce our cost and improve our profit margins. See to that our practice stays in the top areas to give us not only profit, also happiness in our practice. Thank you so much.